Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today, let's talk about how to know your surgical expectations are realistically set. In other words, how to realize that all of your expectations for any gender affirming surgery are within the realm of reality. I recently did a video about managing realistic expectations and how important it is. Well, I just did a short video, one of those 60 seconds or short segments that I do. And one of you asked me, well, how do I know whether my expectations are pretty realistic? And I think that's a really important question, especially when it comes to gender affirming surgery, because gender affirming surgery for a lot of you is a big next step. It's a big deal. It's a very important surgery. So how do you know that your expectations for the surgery are realistically set? So this is not so easy it's not really easy to appraise. Why? Because your subjectivity is going to be very much embedded in those expectations. What do I mean by subjectivity? By subjectivity, I mean your own subjective sense of reality, your own subjective sense of desire, your own subjective sense of hopeful outcome. Oftentimes, when we're going through something as big as surgery, we all have a subjective desire, a subjective endpoint of how things are going to pan out. And those subjective desires are not rooted in objectivity. They oftentimes are offshots, meaning they oftentimes are way exaggerated results or end results that we're really wishing and hoping are going to happen. Think about any of you who are watching have had any gender affirming surgery will know this, or if anybody ever had any kind of other procedures done in order to enhance their looks, the desire is always going to be an offshot. The reason why the desire is always going to be so high up is because we spend a lot of times looking at certain outcomes of other folks. In your case, it's going to be spending a lot of time, and I know that a lot of you do spend a lot of time looking on social media and other platforms at other transgender individuals and the surgeries they had and what was the outcome. And because you're watching all of the other people who had maybe facial feminization and how they look right now, or people who had genital surgery, or people who had top surgery, or people who had mastectomy, or people who had breast augmentation, and you're looking at their outcome, you are going to have a selective bias, meaning you're going to be selecting outcomes that fit into your fantasy and disregarding all of the other outcomes you're going to see out there. Here's the challenge with outcomes out there. Oftentimes, people will boast and put on social media photographs and videos and YouTube video content about themselves and their outcome, and those outcomes were incredibly positive. When people had positive outcomes, they cannot wait to boast about them. Hence, the majority of the results you're going to see are going to be positive. Seldom do people go on social media to talk about surgeries that gone wrong, surgeries that did not work out for them. So I want you to keep that in mind, that for starters, you are already not only stepping into your own confirmation bias, but you're also saturated by outcomes that may not really be majority of the outcomes. Now, I'm not saying that gender affirming surgery cannot be done well. I know a lot of doctors that do phenomenal job, but also know that the outcomes depend on a lot of other factors other than having a skilled surgeon. So for starters, I just want you to realize that to be very realistic about your expectation is going to be a little bit challenging, because you have to acknowledge that your subjective reality, your subjective desire, your subjective wishful thinking is really going to be at play. To get most objective perception of your expectations towards surgery, sit down with a piece of paper and pen and start writing things down. For example, how old are you as an adult? Are you 18? Are you 20? Are you 25? Are you 30? Are you 50? Are you 70? Are you 80 years old? We all know that depending on your age and depending on the surgery you want to get is also going to affect outcome. If you're younger and you're going for facial surgery, perhaps giving you facial structure at a still younger age will have potentially more positive outcome than a person that is older. again, I'm using the word potential because it all varies so drastically. If you're somebody who maybe already had surgeries and already know how your body recovers, that's also going to influence your outcome. Is your body healthy? Is your body in a good, healthy shape to recover from the surgery? If you're having a big surgery, such as a genital surgery, let's say you're going to have a phalloplasty, is your body in a good, healthy stage in order to recover and in order to give that donor side all of the potential, the opportunity to take off successfully? All of this is going to play into the outcomes. Are you a smoker or non-smoker? Again, going to play into outcomes. So all of the things you want to write down on a piece of paper. Who's your surgeon? Is your surgeon one of the top best gender-affirming doctors? Yes, good for you. No, let's be realistic. Is that surgeon somebody who actually done gender-affirming surgery? Can you see their before and after results? How good are they? A lot of times we want to avoid looking at surgical results because we're afraid we're going to see things we don't want to acknowledge for ourselves. But when it comes to surgery, it's really, really important. You're going to get, well, I don't want to put it that way, but let's be honest with ourselves. People who are top-notch in their profession are top-notch in their profession for a reason, right? So you have to be somewhat close to reality and your expectations when it comes to doctor you're going to work with. So give you a banal example. If I went for my Edna signature haircut, although it didn't start out as Edna, but I guess everybody now thinks I am going after the Edna. Okay, so if I went for the signature haircut that I have to Supercuts, which is an inexpensive haircut place, and got this haircut for $20. Well, I have to be pretty realistic that the outcome may not be as even, as perfectly cut as it is now. I may have some other potential issues. Who knows? Maybe the hairdresser will cut it too short. Who knows? Why? Because I'm going to somebody who charges $20 for a haircut versus going to somebody who charges what I pay now for this haircut, knowing that most likely I will get positive results. Are the positive results always guaranteed when you're working with a high-end skilled surgeon? No, but your outcomes highly increases when you do. And if you absolutely cannot work with the best surgeon, I totally understand that. What I really suggest is that let's be honest and realistic about who you're working with, and let's prepare yourself for those expectations. I'm not saying you're going to have botched surgery, God forbid, but what I'm saying is that, you know, if you're working with somebody who has very minimal experience doing mastectomy, which is removal of chest, well, their scarring placement may not be as even. That's because they had less practice. But who knows, maybe as a newbie, they might be also amazing. But it's important for all of you to manage and to have very realistic expectations, so then when things happen, you're not completely crushed. So write down objectively as you can what's really going on in your life and invite somebody else in who can objectively look at your list and ask you important objective questions to assess where you're at when it comes to realistic expectations. The most common things I see are the following. I see a lot of people looking at social media and seeing maybe they have somebody they're following, maybe they have somebody that they really admire, and they've been following the progression of their transition, and they see this person getting particular surgery, and they, by proxy of watching them, they have stepped into this domain of, I don't want to use the word fantasy, but this domain of make-believe that the same thing is going to work out for them and they're going to have the same beautiful outcome. And maybe you will, but I just don't think that's a very realistic way to go forward. I always say, talk to your surgeon about, in terms of your life habits, in terms of your age, in terms of the type of surgery you're going for, and ask them, what do they think they can most deliver realistically on? Take what they're going to say and bring it just a notch down and ask yourself if you're going to be okay with those end results. Because if you're going to be okay with those end results and you move forward with the surgery and you get those end results and you're okay with them, then you're okay because you already prepped yourself for them. If you're going to go through surgery and you're going to get even better results, that's going to be a great icing on the cake. But I always say, have very realistic expectation, take them just a notch down, because with surgery, you never know, things can go wrong that you did not expect, and then just hope for that icing on the cake to land itself. A lot of things depend on how things are going to pan out. Like I said, you can go to the best world surgeon and still not have the best outcomes because things go wrong. Surgeons make mistakes. Your body doesn't respond the way you expect your body to respond. Lots of things go into configuration. But what's going to help you the most is to be as close to reality as possible. The worst case scenarios that I see is when people are not being realistic. I have seen people come to me for evaluation letters, for revisions, when they went to surgeons who are completely not qualified to perform certain procedures. They went blindly to those surgeons because people were so eager to get gender-affirming surgery. I totally get it. People have been waiting, and a lot of you have been waiting a long time. And a lot of you just want to get it over with. And a lot of you just want to take advantage, especially when insurance starts covering certain surgeries. I totally understand that. Totally understand. And I can't blame you for moving forward with the surgery. What I ask of you is, giving all of that, the closer again you're going to be to reality, the better off you're going to be. Why? Because if your expectations are really high and unrealistic, and you come out of surgery and you don't get those expectations, you're going to be very quickly plummeting into depression. And post-surgical depression can be hard, can be painful, and it's not easy. So be as realistic as you can. A lot of surgeries are just fine. People get great outcomes. And we're starting to get so much more gender-affirming surgeons. They're doing a wonderful and amazing job. What I'm seeing again and again is how much social media influences surgical outcomes in a sense inside of your head, because I see a lot of people who are zeroing in on all of these people who had amazing results, disregard all the negative results, because let's be honest, when you're preparing for surgery, you don't want to see negative results because you don't want anything to scare you. You don't want to get overly anxious. You don't want to get overly, you don't want to get your excitement down. So I totally get it. But we cannot disregard reality, people. We're all adults. So this is part of your accountability and responsibility as a patient going through surgery. Your responsibility is also to look into your doctor, is also to consider all of the outcomes. This is not a case scenario where the fault is completely on a surgeon or the fault is completely on a social media. We all have to take our own responsibility and accountability that we play in all of this. So I really, really encourage all of you adults to be mature and insightful, and vet your doctors. Really vet your doctors. You're consumers, so ask those important questions. So hopefully this is helpful. Those of you who had gender-affirming surgery, comment below. Let me know, how did you establish your realistic outcomes? What were your outcomes? Did any of you watching this had very unrealistic outcomes? How did things work out for you? Hopefully they worked out for you great. So comment below. Let me know how all of you have been preparing or have prepared in the past for gender-affirming surgery. Huge steps in transition. My God, I can't even say the word. I've been creating so much content, been saying that word. I can't even say it anymore. So comment below, let me know. Love listening to all of your comments, and I will see you all next time. Bye.